Ireland's health system was the victim of a ransomware attack, and it is completely shut down. Reuters reported today that the health service was shutting off all IT after they experienced a significant ransomware attack, and that was significant was their wording. The attack was blamed on threat actors targeting healthcare records. Again, very robust, areas of personally identifiable information. The attack has completely shut down all COVID-19 testing. Hospitals have canceled all not urgent appointments, all diagnostic services, and they're only accepting emergency room appointments and seeing women who are 36 weeks pregnant or more. And so the attack actually targeted computers that were storing patient records. And a hospital in Dublin was the one that was shutting down services. And this is on the heels of what you talked about in our show last week, the attack on Belgium.
Right.
So the world over, we are seeing cyber attacks and threat actors shutting down hospitals, governments, governments, pipelines.
There's possibly a good side of that here moving forward. I say possibly because we've been talking about the dark side. They recently, I think just yesterday, announced that they had some of their servers actually confiscated. Law enforcement had gone in and shut down their, I believe it was their blog server, their payment processing server, and their denial of service attack service. So they had been seized, based on the court order. We don't know who, but it is interesting because the dark side, as we've talked about previously, they have gone out of their way to say, look, we're a business operation. We're not the bad guys here. They've donated to charitable causes to kind of pull off
whatever. That doesn't make them good guys.
Right. But now you see them and you see others, like our evil that we mentioned previously, stepping up and saying, look, we're not going to, as part of our, Crime Inc. or our, our cyber, collaborative here, of attackers, we're not going to do work in the social sector for healthcare, education, et cetera. We're not going to do work on government sites. We're not going to sanction that. We're not going to sanction anything that is really that important that people's lives could be at risk coming out of it. Now, that's a couple of organizations saying that, and unfortunately, while that may set sort of a tone moving forward, which is a bizarre thing to say, that we have organized crime saying, look, here are the rules of conduct that we're going to put in place. The reality is that there are so many rogue actors out there, and people that don't have the scruples. And, clearly the group that targeted, Ireland's healthcare system, that's a different beast. And we need to find a way to combat that, to stop that in its tracks. It's gone too far.